I'm often asked by parents how their psychoeducational assessment differs from the Arrowsmith assessment. Anyone who's been in the field of special education knows that a psychoeducational assessment is usually done by a school system, school board, to identify a certain type of disability. So most of these psych ed assessments are used for labeling purposes, for identification, for funding purposes for school districts and school boards. So, a school district might diagnose a child with a learning disability with a psych ed assessment. The minimum requirement usually for a psych ed assessment for diagnosis and labeling and services is usually an IQ test, a Wechsler Intelligence Scale for Children, maybe a few other cognitive measures, and then achievement testing. And what you want to see is a discrepancy. Is there a discrepancy in terms of where their intelligence is versus where their reading, writing, or spelling is? So for example, if their intelligence is average, but their reading, writing, and spelling is at the 10th percent, which is low, there's a high likelihood that they'd be identified as having a learning disability. Unfortunately, psych ed assessments at times are not overly informative as to the reason that child has a learning disability. And what I mean by reason is what is the cognitive functions that is causing this child to struggle with reading. Many psych ed assessments do not explore the broad range of cognitive function responsible for reading disabilities, math disabilities, written expression disabilities, and other types of learning difficulties like receptive and expressive language, social difficulties with nonverbal behavior. The reason a lot of these psych ed assessments are not comprehensive is that many psychologists who work for the school system are not given a lot of time to conduct psych ed assessments, sometimes 2 hours, sometimes 3 hours, where in fact, a really comprehensive psych ed assessment, could take 1 day or 2 days to really try to understand the cognitive reasons why this child's struggling. And when I say cognitive, I mean neurological or brain-based reasons for these difficulties the child's experiencing. And that's a psych ed assessment. The Arrowsmith assessment, its primary purpose is to identify at least up to 19 cognitive functions responsible for academic and social interactions with their environment. It's not used to label a learning disability. So the Arrowsmith assessment isn't used to diagnose dyslexia, diagnose dysgraphia, nor is it used for funding purposes. So a parent who does the Arrowsmith assessment can't take it back to their school system and ask for special learning assistance because of the Arrowsmith assessment. The Arrowsmith assessment is to identify these cognitive dysfunctions and then to build a cognitive intervention program called the Arrowsmith program around that assessment. And that's what I think is very exciting about the Arrowsmith assessment. Its primary purpose is to design cognitive intervention. So it's assessment to intervention. So the parents who give us their psych eds and look at the Arrowsmith assessment often ask us to compare the two. Unfortunately, not everything that is done with the Arrowsmith assessment in terms of all these cognitive areas is actually done with the psych ed assessment, so you often can't sort of compare and contrast the two reports. Although there's some overlapping cognitive functions that are measured in IQ testing or cognitive testing in a psych ed that could be comparable to the Arrowsmith assessment, and sometimes we point that out to families and those who might be interested. So again, the primary purpose of the Arrowsmith assessment is to build a cognitive intervention program. The primary purpose for a psych ed is usually identification, labeling, and some recommendations for intervention.